The overall well-being is a joint venture or a joint effort by both doctor and patient, and both have to play their roles with meticulously and honestly to achieve their unison objective. Be it any surgical procedure or any routine OPD visit, the cooperation of the patient, especially with a relevant medical history, is of paramount importance. Namaskar, I am Dr. Prasun Sanyal, consultant arthroplastic surgeon. So in this video, I am going to describe the role and responsibility of the patients in different contexts of their visits, both in the OPD as well as in the surgical procedure. First, I will discuss the responsibility of the patient in context to the routine outdoor visits. Patients should always give proper and detailed medical history, especially if there is any family history of malignancy or any family history of tuberculosis or any past medical history which is pertaining to the disease. Any woman of the childbearing age should declare whether she has a pregnancy or not, because most of the cases we have to prescribe an X-ray which is harmful or deleterious for the pregnancy. Patients with hepatitis B, hepatitis C or HIV should inform the doctor about their clinical condition. Confidentiality will be preserved. Any patients with any cardiac pacemaker or any non-titanium metallic implants or any cochlear implants should inform, because these are relative contraindications for undergoing MRI scans. Patients should always inform about their known drug allergies and any hypersensitivity reactions, because it will alert the doctor regarding prescribing that group of medications. Now, from the surgical point of view, the role of the patient becomes even more pivotal. Why patient role matters? Joint replacement surgery is only the part of the journey. Your recovery and long-term success is dependent as much on what you do as a patient, from mental preparation, from physical rehabilitation to your active participation is the key. So let's break into two parts: prior to surgery and after the surgery. Before surgery, what is expected? After there is a pre-anesthetic clearance and evaluation, there will be a prehab where the patient is instructed to perform muscle strengthening exercise. This helps to recover the muscle strength and fastens the rehabilitation. Stop smoking and achieve adequate control of the diabetes, because smoking reduces the wound healing potential and diabetes increases the chances of infection. Post surgery, what is expected? Early movement. The patient is instructed to start ambulation with support within 24 to 48 hours and do physiotherapy as per the regimen or protocol. They need to take the medications as per schedule. The anticoagulant, blood thinners or antibiotics should be taken as per schedule prescription. Don't skip medicines assuming that you are feeling better. Strictly follow the diet advice. Include high protein diet, calcium rich food and fluids. Avoid oily preparations, alcohol and any sort of addictions which can slow the healing process. And definitely avoid the mistakes of skipping the physiotherapy session, ignoring any redness, swelling, pain, warmth of the local site, walking too much at too early phase without any support, not following up with your doctor feeling you are absolutely fine. Follow-up is the most essential part of a long-term successful joint replacement surgery. Ideally, the patient should do follow-up 3 weeks after the surgery for staples removal, then after 3 months, then 6 months and 1 year after the surgery. After the 1 year follow-up is completed, then the patient are instructed to follow up every yearly once. These follow-ups are very crucial to detect any early post-operative complications. Apart from these routine follow-ups, you need to contact your doctor immediately if you experience sudden onset of pain, swelling around the operated site, there is a fever or excessive pain in the operated site, or you feel unstable while walking. Never wait for things to worsen. Early action prevents long-term serious complications. Joint replacement, it is a shared responsibility. You bring the discipline, we bring the expertise. Together we bring you back to pain-free movement. If you find this video helpful, then share it with someone who is preparing for the surgery. Thank you.